Your crowd has not come yet.
I was telling her why.
She doesn't want to be in
Don't take your
diapers.
time, take your time. Are you ready, Pat?
Wait, go to meetings in diapers and...
Okay. I would like to call to order the Budget Committee meeting of December 2nd, 2015. With permission of the committee, I would like to postpone the reading of the meeting minutes and go directly to the Lockmere Village District Report. Any concerns or questions? Sir, the table is yours.
Okay, I am Paul Boudreau, Commissioner for the Lockmere Village District, and we have prepared our budget. It's been aired at our meetings and approved, and fortunately, it has to be signed by you people, because we are too small to have our own budget committee, so the town has to approve it. So it's here for your signatures, and
Any significant changes?
no changes, no raises in water rates or anything. We're going on day by day, and we're in good shape.
Good. Would you like to add to that, ma'am?
No.
Okay. Ready for questions? Or would you like to continue?
No, we're just waiting for your approval, and
Good.
we can be on our way.
Good job. Hit from the end. Christine, any questions?
No, it doesn't look like there's much of a significant difference from the prior year.
No.
I mean, it's only $900 maybe, if that.
Yeah.
So we're able to keep our rates where they belong, and
That's great.
it's good.
Good. Jules?
Not much, were there any significant changes over this past year that you want to talk about to the public? Projects
Not really.
like that? Upcoming projects, possibly?
The system was formed in '93, or in that era, and it's fairly new. So we've been making up-to-date changes in our systems, and God, it's been running smooth, and we keep our fingers crossed. You know how it is. We hope we don't have any pipes breaking. And our biggest commitment right now is to the, not White Rock, but the Gaslight Village. We're waiting for them to come online, because when we do have a problem, that's the first place we go to. I mean, it's the weakest point in our system. And, yeah, when they get upgraded, we'll be in good shape. White Rock is all
That's going to be fairly
done.
soon, right?
We haven't heard anything from them.
I've gone to the engineers. They're going out to bid for engineers,
Oh, good, good.
from what I understand.
They should be notifying us so we can attend a few meetings and all that, but we haven't heard boo yet.
They only periodically come to us because we manage the grant.
Jules, further questions?
I am good, thank you.
Jane?
And that was my question, is about new customers or add-ons, and you answered it already.
We've had one or two new customers a year, and it seems to be just
Try it.
good.
Yep.
Pat? Questions?
For the sake of the seniors waiting for the best musician ever, no questions.
Peter, you came in at the wrong time. Any questions, Peter?
What, for the Lockmere Water District?
Yes.
I have none.
I always get this my point. Catherine! What? Any questions?
No, it's Paul.
Okay, could I have the copies, please, that I gave to Jules and Christine? John, you have them? Okay, John, would you start the signatures?
Yeah.
And you're on your way, sir.
Very good, thank you.
Well, thank you.
We'll put them all together.
Good job, guys, as usual.
Yeah, we keep it
Next
going.
time, bring your guitar and serenade us first.
There you go.
I was secretary to say baby. York's here too.
Well, not.
There's nothing there.
Not today, yeah.
Freckle.
Look at the bus chair.
American time to sign.
That's great. Gets that chair.
Sorry for my turn.
Have to stay after.
I would have texted, but then I would have been driving.
No, no.
Yeah.
Well, the guy that tried to make,
One's got changed over to ice, that's why I get.
except for the guy that was trying to make a right turn from the left lane to get into Walmart.
I was typing this
A little better planning. Am I supposed to sign something?
bylaws and everything.
Just like that, sir.
Just like that.
That sounds
We get them onto the state.
Everybody back?
Time consuming.
Bank was short. I got his. Thank you.
Some of these,
There every night.
this one is not even functional.
I put that in there. That was a present for Pat.
Oh, that works. Wouldn't work on your petition budget, but it works now. John, you have the magic touch. Coming back to you, Eric.
It's all right, I'm good.
Do you have any questions while you're waiting?
Any big changes?
Nope.
Nope.
Gaslight's gonna be coming on eventually.
Gaslight will come onto that. Is that system?
Yeah.
Would that be a big expense to the town, or is that, they pay for
Good
that?
grant for that.
And they have a big grant.
Okay.
Gaslight does.
Oh, they are a customer, but they're upgrading. They're putting in all new water pipes. The weak link in their system is their water pipes, which is a very, very old system.
Where's the line for that system? Like, the line of demarcation, for lack of a better word? Like, where's the district
How far
end? Yeah, how far does this?
There is a map. It doesn't go very far. It goes like to Lancaster Hill Road,
Yeah,
Grange Road. And the other end is just about Silver Lake Road.
So it crosses the street.
And then we have the river and Route 3. It's not really a big system.
Down to the dam, well,
Yeah, to the dam, Silver Lake Road.
Silver Lake
and
Road,
then all the little roads in there.
Church Street, no?
No,
Ashland.
we don't go to the Ashlot end of it.
No.
That's another water system. That's the Pennachuck.
Oh, jeez.
We had been approached to buy that system years ago, many times. And looking at it,
Just one. Yeah.
we thought, to do anything with it, it would have to be upgraded. And why buy it if you have to build it again? We just left it.
So,
But Pennachuck's making a business out of it.
Okay,
we need one, we need two.
if you get Joanna one on the way out, she will be very happy.
Thank you, gentlemen, very much.
Thank you for coming.
Thank you, guys. Have fun.
Thank you very much.
You're welcome.
Go pick away.
We'll do it again next year.
Go get him. Peter, would you like to join us?
No, Catherine's going to.
Okay, Catherine, would you like, both of you come up here. I'm gonna whack him. Can I whack him?
Whack 'em.
No, you want one of these
Lean over, we're gonna whack you.
Joanna, can I whack him?
gingery.
Okay, I can whack him. Joanna says okay.
Lean over.
Thank you, folks. Sewer Commission, what's new?
They're full of shit.
I bet. My brother keeps telling me.
He said, what's new?
Oh, snow.
Oh, you poop
No
every...
snow, that's new.
Yes.
Good thing. Hopefully we get it from about December 4th to January 1st, and I'd be happy.
Okay, Peter or Catherine, who's going to take lead?
What would you like to know? 50% increase in rate increase?
Okay, significant changes, anything?
We're trying to flatline it.
Is this a sewer?
Right here.
Sewer Commission, yep.
Sewer.
So you tried to flatline?
Basically, we've got it as a zero increase based on not having surprises occur. Last year's surprise was Lakewood Pump Station required a major overhaul, so we don't always,
Which one, where's?
Lakewood. Lakewood,
Between Anchorage
before Sunrise Shores.
Okay, I know where it is.
One of the, it's a condo-type development. And those twin pipes, I think part of the problem, we got the beach area, people showering, there was a fair amount of sand getting into the system, so I think that affected the pumps and cut their lives down. So we did a major overhaul there. we're trying to hold firm. The Winnipesaukee River Basin Program, which is the Franklin Treatment Plant, and then we've got 10 communities that discharge into it, are sort of in a flux right now as to how we're going to proceed in the future. Is it going to go as it currently is, where we maintain our structures in Tilton and the other towns do? Are they looking at the state to take over the control of everything, or a third entity? So with that in mind, we're not pushing a whole lot of repair projects. It's more, as things break, we're going to fix it. A future project we're going to try to get some engineering done to look at is going to be West Main Street, sort of finishing from about the high school to the town line, with an alternative going up, partway up Clark Road. Clark Road, the issue is going to be ledge. When you deal in ledge, that increases price dramatically rather quickly. West Main isn't bad. If we can get sewer down there, then you look at, like, some of that Turchin property and all may become much more valuable, because you'll have sewer that you can now tie into, especially if you're looking for commercial, industrial type development. With your treatment systems, you're better off to go with a sewer system.
And the garage, too.
Yeah, yeah. They just may need pre-treatment to meet the treatment plant's requirements.
Catherine, anything to add?
No, the only increases you will see from the 2015 to 2016 is in the engineering, as Peter said, because that project, and then payroll.
Normally I'd have people sign in, but I don't consider you an outside agency, so, for some strange reason, so we'll just ignore that. Okay, Peter, anything else you'd like to add?
Not unless you have questions.
Ready for questions? That's the next piece. I would go to Catherine, but you're actually sitting here. Pat, questions?
Let me dig up.
Look at that, I woke her up back there.
No, I was going
I like the
What's the increase in the
14,000.
payroll this year? What percent?
This year to next? Or
7,000.
Well, it was all employees.
What percent increase do you have? Just
Johanna, do you know offhand what we did? I don't remember.
I don't remember what the percent was.
But it represents, what, 3? 3 people?
Yes.
3 employees?
So 7,000 represents the 3 people?
Yes.
Telephone. This is for all the other units that you have outside, right?
yeah, just under $40 a month per phone. Pretty much every pump station has one, or the majority of the pump stations have one.
It's the alarms system, or notifying system.
Oh, no.
Yeah. So whether they call me or not, we pay $39-something a month. We finally got them so they're all billed the same. That we had years they were off by a few pennies each, which we couldn't figure out.
I was just thinking if there was a way to
To try to check with Tim to see if there's some way to get some sort of card on a local program, which I don't know if there is or not. Because that's the only calls they're going to do is
Wireless, take
something like that, maybe.
probably pretty close to $40, I would say.
So, yeah,
I mean,
But
you could go to
alarm
just a red
systems.
light on them, but then you're relying on neighbors or passerbys to tell you, oh, the red light's on. But some of them do have red lights on, and I'm here to tell you, they don't call you. Oh, yeah, it's been on for a couple of weeks.
People don't even pay attention to car alarms.
Well, yeah, so the system with the cell phones is the best one for immediate notification. We've had some real issues.
The other one that I saw was the education. I mean, I'm a big proponent of education, and if there's classes that you go into because you overspent it by 220%, There's
Flagger
classes.
School
But
this
look
year.
how much money. It's almost no
Flagger
money.
School was, I think.
The Flagger School sent it over.
Yeah, but
It was
this,
unanticipated.
But is that the only thing that was,
The other stuff, I think, was more anticipated as part of,
I continue to take classes on, this year I was certified in pipes and the televising, so that's what that was this year.
And I'll start taking classes next year. As I have time.
Water is a changing field and you've got to keep your education and knowledge up on it.
I totally agree with that. I couldn't agree with you more. And I think education is really important in the job that you're working at. If you don't know what you're doing, you shouldn't be in the job. That's why I'm saying if you're overspending it by 220, 500 is not enough. Did I say that?
Yeah.
But that was, like you said, it was just because we did Flagger School.
Yeah, I think that.
Pat said,
Going forward.
writing it down.
you want me to go to Flagger School, is that what you're saying?
Well, we can have that with Health Trust now.
Okay.
Then do a demonstration, bring your flags in.
Yeah,
And we are flaggers.
I'm done.
Okay. Pat, further questions? Okay, Eric?
Well, what is a cap charge?
That's some mysterious number that the DES, Winnipesaukee River Basin Program, comes up with, trying to keep the system up to date and all, and they've underfunded it for decades.
Well, when we're, if you want to talk about 200%, or 200% of that, so are we over, I mean, and then we're down 35% and something else, so
Well,
is
every
it?
now and then they get a little lax and they forget to bill in a quarter one year, so then the next quarter and the next year they double bill us, so that, I think, was that spike, wasn't it?
That was that spike. The cap charges cover projects that are done at the plant.
Yeah.
Each community pays a portion of. And this year it was billed twice because they neglected to bill us last year.
So last year we were under budget, and then this year and hopefully next year we'll be on budget, even it out.
You never know with DES.
Well, it's, yeah.
Well,
But that's
so-
what it should be.
So if I'm looking at this, we're $25,000 over budget. Where does that come out of?
Well, you see the engineering was up by 5,000.
Well, no, I'm just looking at,
Where do you get the money?
I'm looking at,
DES
I'm looking at 2015 budget is 449,000. Actuals as of December 1st is 475,000, which means we're $25,000 over budget. Where does that money come from?
From the maintenance and
I don't know,
repair.
where do we get the money?
Where is that, yeah, I mean, obviously,
Out of the reserve fund.
okay.
What's that balance currently? Between 6 and 7, isn't it?
Yeah, somewhere
6 and
there.
700,000.
Okay.
What does it cost to repair that, one station now? 400 and some odd last year, wasn't it?
What, the Lakewood station?
Yeah.
No, that would have been,
If one of those goes down, that wipes out your whole maintenance budget.
no,
No,
I have those.
Last year, we replaced Mill Street, we retrofitted Mill Street, and that was about 90,000.
Oh, okay.
new pump stations, brand new, soup to nuts, depending on their size, are probably between 100 and 150,000.
Further questions, Eric?
Nope, I just was curious where's it come out of, so.
You're up, John?
Couple things. I think 14,495% over budget is about the biggest number, but it's pretty funny. Nobody get alarmed because it was only $1 in the budget, so it was only $149.
But it's that catch-all line miscellaneous.
I think you hit the max on that number there. To capital reserve, nothing going in next year? The reason why I was thinking is if we're gonna be doing like Caliph Hill Road and that, what's our
I don't
expense gonna be?
see us extending sewer on Caliph Hill. It's gonna be cost prohibitive.
I don't know.
Oh, so there's no sewer up there? No.
About the first 4 houses on both sides. The Tom Gallant's 4 houses on the left are, I think, on the edge of Caleb Hill Road. The houses on the right that have been there longer, it's on the back side of the house and those houses, and it's a private line.
What other roads were there that the state's redoing? You know, are we going to be replacing some pipes on those or rebuilding?
What we're looking at for our next project would be West Main Street from about the high school to the town line, with a alternate of also possibly going up Clark Road if the price is okay. Rogers Park there at the intersection already has sewer. We're nearing the point it's going to be cost prohibitive for projects. Other potential projects might be like the old Sherryland Park up on Winter Street if you go cross-country toward Walmart and tie into what's called the Rogers line that crosses by AutoServe. Because going cross-country down the power line and all, it's not that far if we have to go down School Street. With ledge and all, it's going to be cost prohibitive.
Is there a line out by MB Tractor? Is there a spur going out there?
The Andrews Road project.
No, I think he's talking Bittern
Oh,
Lane.
Bittern?
Bittern, yeah.
Yeah.
I think,
Not down Bittern.
it goes down a ways, does MB has it, doesn't it? And I think the manhole ends right at the entrance to the proposed athletic, there is a line
So
there.
that'll be their
That's right,
cost
there
to
is.
tie into that, so, cost, you think? Yeah, that's all I can,
Yeah, that
Yeah.
new facility.
Is that where you would go across the old Sherryland?
No, the Sherry Lane's gonna come through the power lines and then come into, if you go out
Backside of
past,
Walmart.
backside of Walmart, there's a mobile home park out there.
Yeah, I know
Tie
where that-
in
yeah,
where the
yeah.
power line crosses
Yeah.
in there.
John, anything further? Jane?
We're not talking a lot of money, just curiosity questions. The abatement and refunds, why were they up so much more this year?
Could be a number of reasons. It could be due to water leaks. Sometimes we'll abate for water leaks, or if I make an error in billing, that'll go under abatements.
Okay.
Also, what'll happen is we give a billing, and then they'll show us that it's usually a seasonal property that they've shut it down. They can show us that there was no power going to it, so we abate it. If they're non-metered, it's 85 a quarter. And metered, the minimum rate is 35 a quarter, so we abate it from the 85 to 35, so we get 2 or 3 that might do that per year also.
Now, on your electricity, do you shop around for the best rate, the way the town does, or?
Yeah, Tim handles that for us.
Tim does, okay. So that's why that's as low as it is. And then, some of these have been answered, the miscellaneous, 3 people. All right, all the others were answered.
Good.
Somebody else's questions, thank you.
Jules?
Looks like your revenues went up from 13 to 14, and I was wondering if you had a projection for this year? Is it going up again? Or,
It's sort of a hard thing. We don't have any new projects, so now it's going to be based on user. Anyone that's on metered systems, it's actual usage. If you don't have a meter, we do a flat rate. So the flat rates will stay consistent. We're not looking at rate increases at this point. If you're on metered, then it's whatever you use, and it's 3.5 cents a cubic foot,
so you think it'll be about the same
most likely.
as last year?
Would something like that Taco Bell that went in, would that affect your,
Most of those type restaurants don't do a whole lot of washing, so whatever, it'll be
minimal?
minimal.
Yeah.
What if it was like a seated restaurant? Let's just say like a
Really be more like a housing development.
housing, okay.
Or a hotel.
Yeah.
Didn't mean to jump
Yeah,
in,
something
but
where you've got a fair
changed my
amount of
mind.
people.
Hotel with a laundry facility.
Beds.
Yeah.
showers.
Right.
Jules, further questions?
That's it for now.
Let's talk,
I'm going to do Christine, I'll come back to you. Christine, questions?
I'm all set, everybody answered every single one all the way down.
See, Johnny, we're right back to you anyways.
That's probably what it is.
Yeah.
talked a while ago, there was something going on with the way that they bill us for that line, because they're not sure who uses how much. Went from Laconia.
They're in the process of doing a metering study. Of course, one of the
6
meters
years or
at the
something.
west end of town, I'm not sure if when the Caleb Hill Road project was done, they didn't break one of our lines, because we had a fair amount of gravel in it, and that was screwing up the meter. I think
To our advantage?
well, they couldn't do readings, so
It
they,
cost us money to clear the line.
yeah, but
So you might save some on sewer, but
yeah, and I think we may be at the point that we've got the excess gravel cleared out of it. Because we flushed it, and I think we cambered it after it, didn't we?
Yep.
Because let's see, so what they do, they meter,
At wherever it comes into town and leaves town, and then do the calculations. Because currently, we're based from when the Winnipesaukee River Basin went in 82, and at that point, we were estimated at, I believe, 5% of the total cost. If the metering goes in, I can't see us doing anything but going up because of the amount of projects we've added.
yeah, that's true, to the houses.
Yeah, we've been, I think we've been fortunate that we've been able to get a lot of projects in, looking to protect both the two lakes and the river.
Further questions? No. Further questions from the Budget Committee or the Select Board? Thank you. Enjoy the evening. That was too easy, huh?
I know. Wish they were all this way, huh?
I didn't even get a chance to harass you, Catherine. I know.
You have a chance, call her back.
I will. Folks from Genesis, is your team here? If it is, come on up and join us. Welcome. Who's playing with the candy? Kids.
Hey, that's good candy.
Okay,
Pat and I were in there.
pass the candy down to that end.
Ginger's
Okay. Well, I would have you sign in. There's an outside agency. Who knows? I've lost control. That's okay. We've lost control. We're okay.
Our personal names and the agency, is that right, or just the agency?
Just your names. Yes. Federal state laws drive me crazy. We now have to put them on file, and you put them on file, and you have to hold them for so long. Yeah, it's a waste of paper. I'd rather shred them. Get on with it.
100%.
There's Catherine. I keep an eye on Catherine over there. Now, as we're signing in, I'll have everyone go around and introduce themselves. If you get a question from the back of the room here, feel free to turn around and face whoever you're talking to. We don't take it personal for your back. It's much easier than trying to turn around, okay? So, who would like to start on your team?
Okay, I'm Susan Stearns, and I'm a member of the Board of Genesis Behavioral Health, a resident of Northwood, and I'm past president. I am no longer president of the board.
Good.
And I'm Kristen Welch. I'm the Director of Development and Communications for Genesis Behavioral Health.
I'm Jason Dreiser. I'm a resident of Hampton and the incoming president for the board. So thanks for having us here. We really appreciate you reaching out and inviting us and requesting a proposal for information. We appreciate that.
Okay, no, just, we'll get back in a minute to opening. Can we try to keep things simple? Hey, we get old. First off, thank you for inviting me to the time up there. I was not able to go because I had another meeting. Stuff over the board, but behind you, right there is...
Catherine Johnson, for the selection.
Over here, we have Pat Constantino.
Peter Fogg.
Of the Select Board. Eric?
Eric Pyra.
And I'm John Scanlon, Selectman.
And ex officio member of the Budget Committee, get stuck with us. Wayne Brock,
Jane Alden.
Juliet Harvey?
and you would like to start, sir?
Sure.
There you go.
Yeah, well, thanks again for inviting us and having us here. We really do appreciate it. As you know, we've been coming before you for a number of years, seeking your approval for a budget consideration around our emergency planning services. We ask each of the towns within our catchment area to give us some dollars towards our emergency services. We actually use a model that was designed of a recommendation from a Tilton Select Board budget member years ago that we have then followed and implemented throughout all of our request processes. We find ourselves at Genesis at a really interesting crossroads in our experience. If you remember 2 years ago when we were here, we were running in a deficit pretty significantly, and if you look at our past financials, you'll see that we were running in our line of credit significantly to the point of where we were at about $1.2 million in our line of credit because the state was not providing us with enough income to provide the support that we needed to adequately serve the region. The state then went and moved to what was called managed care, and so we realigned our organization, restructured it, redesigned it, and the managed care concept was to provide us with a revenue stream that would adequately serve the community and be able to adequately provide the staffing support that we needed. As you look at our financials, you'll see that indeed it worked. We restructured in the way that we should, we managed our costs the ways that we should, and we were moving forward in a positive direction. Last August, we were told that we were going to receive a 30% decrease in our funding from the state for all of the organizations across the state. As you look more closely at our financials, you'll see that we have then begun to move back into a deficit. So where we were once an organization that was operating in a positive direction and looking for ways that we were even going to invest and potentially in a year or two not have to come before any of the communities to say that we need this additional support for emergency operations, we find ourselves once again heading back down the direction where we are running in the deficit again for the So that started September 1st. We ran in a deficit for the month of September. We run in a deficit for the month of October, and we're projecting once again that thanks to the reductions from the state, that we are heading towards a place where we will not be able to maintain our operations or our support services that we've been able to provide. So the only thing that we ask the towns for is dollars to help us support the emergency management systems that we have in place. Those are open and accessible to everyone within the town. We work in strong partnership with the police and the fire departments as well in trying to reach out. Franklin Hospital is obviously a strong partner with us in some of the emergency services that we would provide. And the Tilton residents would go to Franklin Hospital for some of the support services they need in crisis. And so the dollars we're asking for are really based off of those crisis dollars to help residents hopefully quickly return back to a healthier state and/or help them resolve the crisis and/or move them into a managed service with us or with another mental health care provider to return to a healthier track.
So just a few interesting points that I found as I was looking through the data for the past few years.
You may want to pull that off. You're very soft-spoken.
I am very soft-spoken.
There you go.
Thank you. So over the past 3 years, we've seen an 81% increase in emergency services usage by Tilton residents alone. Across the board, at Genesis, there was a 25% increase in emergency services patients this year, but for Tilton, over the last 3 years, we've seen an 81% increase, which is fairly dramatic, I think. We've seen a 14% increase in patients from Tilton over 3 years. Charity care provided has fluctuated. The question often comes up, why don't you ask for what the charity care that you gave to our town residents? And the reason we don't do that is because it does fluctuate. There are so many factors that come into play with that, and this year, especially with Medicaid expansion, we did see a reduction in the amount of charity care we provided to every town. But that's why we use the formula that, I'm not sure who suggested it, I wasn't here then, but it was suggested by this town that we base it off the emergency services deficit and the population of the town that we serve, since this emergency services is accessible to anyone in your town, whether they're a patient of ours or not, whether they have insurance or not, and whether they have the financial resources to pay or not. So that's why we do it that way. So as I said, that's fluctuated throughout the years, but I thought those were some interesting points. I did bring our October financials because when we did the application, I only had August. So as Jim mentioned, you'll see from these that we did have a deficit for the month of October.
Power control?
Oh, those are of interest. But
Anything else?
I'm happy to answer any questions that people
We'll
may
get there
have,
in
but
just a second. Ma'am?
I think that, Jim and Kristen have pretty, comprehensively covered, what the issue is. I serve on the board at Genesis as a family member who I have a lot of emergency treatment through Genesis for a number of years. And so I've seen firsthand how critical those services are to, obviously my family, but as they are to many families. We do, receive support from the majority of the towns that we serve for emergency services. And would certainly like to be able to see that support come from the town of Tilton. As mentioned, certainly folks here in Tilton do utilize our emergency services. Pretty much it.
Excellent. Wander around the camera just drives everyone crazy, which is nice. Catherine, you ready for questions?
Yep.
sure.
Catherine, would you like to start us? I got you.
You can say no questions, it's okay.
Okay. How many years I've done this? Basically, you're looking for emergency services. But when you are called for emergency services for anyone that's maybe an outpatient and whatnot, and they don't have the ability to pay, how long do you carry them? Do you carry them through their mental crisis for months? Or, my understanding I'm trying to remember last year, the description was, if they're in the outpatient, somebody sees them, or they may not physically go there, you do it through some kind of video.
Yeah.
So we are able to provide up to 6 crisis visits. So our clinicians can see somebody they'll either physically go to the emergency room. We do only have one clinician on call, and that's a cost-saving measure because having the staff on call 24/7, just like your police and fire department that you have for the town, we have to have somebody on call 24/7. So we only have one clinician on call, and that's why we utilize the telehealth equipment. So that we serve 3 hospitals with emergency services. So if there's a patient at Spear, a patient at Franklin, and a patient at LRGH, that person can see all 3 of them. They can physically go to LRGH, they can see the person in Franklin through the televideo equipment. So that's a cost saving and efficiency measure, and it gets the patient better care, because if that person in Franklin had to wait for them to finish up at Lakes and then have them go to Franklin, that would be a long time for...
But they shouldn't have to wait.
They shouldn't have to wait, and that's why we use the telehealth equipment, so that they can see the person more rapidly.
So what happens to them after the 6 visits?
We try whatever we can to get them into services. So we have benefits specialists who can help them apply for Medicaid. Now that with Medicaid, with the New Hampshire Health Protection Program, we're able to help them apply for that. So we do what we can to get people in. We are required to provide an intake to anyone in need, so we will do that for somebody, and then help them find...
Okay, let's say I've had my 6 visits, I have no ability to pay, and I don't qualify for Medicaid or anything else. What happens to me?
Actually, under the health protection program, if you have no ability to pay, you will qualify for Medicaid.
No, I beg to differ. As I can tell you, my husband was completely physically disabled, had absolutely no ability to pay, no assets, and he qualified for nothing, not even Social Security disability.
Well, disability is a much higher standard than the health
He
protection
qualified for
program.
nothing, not even Medicaid.
The health protection program
So there are
is
people-
solely based on your income.
There are people, I can tell you.
Was this recently within the last year? So these would be changes that
He
would
passed
have...
away 2 years ago.
Yeah, so these would be changes that have happened in the last year.
This has only been in place for a year, and
But even so let's go back 2 years ago. What would have happened to him?
So if he needed short-term counseling, we do what we can to help people, and that's where the charity care comes in. We do have a sliding fee scale. We receive grants from Belknap and Grafton County to provide up to 12 sessions of therapy for people. That's completely separate funding from what we ask the towns for. That's for
So
another
eventually
program.
it'd have to be passed on to somebody else.
Actually, there's nowhere else he would be able to go.
Right, there's nowhere else he would
Yeah,
go.
no, yeah, not unless he's a danger to himself or others to be eligible for admission to the state hospital. He would have been treated by Genesis Behavioral Health, and if indeed he were impaired to the point that he was unable to work, then he would have been able to be certified for disability. I can't think of what happened in your husband's case. As we said, 2 years ago, the health protection program didn't exist. Now we do have the health protection program, so you don't even have to be at that level of disability to be certified as disabled, which anyone who's helped a loved one through that. It's a lengthy process, a laborious one, and they make the system doesn't make it easy. But now with the New Hampshire Health Protection Program, it's based solely on your income and eligible for Medicaid. That said, if you are indeed disabled by your mental illness, you still would qualify to be certified and receive even more services under Medicaid once you're certified as disabled.
Anything else, Catherine? Christine?
Do you have a reason why the increase was larger for the Tilton residents? What was going on that we saw a lot more Tilton?
It's hard to say. I don't know why the increase. Like I said, it really does vary year to year from town to town. Some towns, it stays relatively the same. Some will see a jump from year to year. So I'm not I can't really answer that, but there are other towns where we've seen the same pattern, and as I said, across the board for emergency services, we saw that trend in almost every town this year. It either stayed the same or it went up. So,
So those increases you were talking about were just for emergency services?
yes. We did see an increase in overall patients as well, but it wasn't as dramatic as emergency services. It was in fiscal year 14, we served 3,642 patients. Last year, we served 3,843. I think part of it is people are more aware of services for mental health, and they're seeking the services, and the outreach is better, I think.
Now you have a board, right?
Correct.
Is there anybody from Tilton on that board?
I don't think we have a Tilton resident.
No, we do have people who work in Tilton on the board. We don't have a Tilton resident on the board. We did for a while.
We would happily welcome.
We would love a Tilton resident on our board. It's actually something we've been seeking for a while, so if that is something you're interested in, please let us know.
Yeah, we do try to get someone from every one of the towns.
I have no problem with that.
So we would welcome a recommendation as well.
Okay.
This doesn't have to be you.
What John was doing was kicking me because he knows I'm retired.
Oh.
No.
It's a member.
We will talk afterwards. I don't have a problem with that. Christine, continue.
Do you also have anybody on the board or within the organization that can look at all your items to do cost cutting, like printing or, supplies or what? Who does that?
Every year, we have a finance committee that is made up of volunteer members, most of whom have accounting, financial background.
Is anyone from Tilton?
Yeah, the board is comprised of members of our overall board.
Okay.
A couple of folks who volunteer, again, we'd welcome someone to do that as well. But we scrub the budgets.
I'm going to do this now.
We scrub the budgets pretty carefully. The greatest bulk of our expenses goes to personnel. We're a labor intensive.
That's what I was looking at, was the next thing was all of a sudden there was a
If you've been
jump.
to our facilities, you know that our facilities are not very nice. In our strategic plan, we're looking to enhance our facilities because we want the quality of patient care to be stronger, better, and we know that the facility matters. But we really operate as little as humanly possible without trying to pay our employees a fair rate of food.
What is substitute staff?
That is when we have to bring in they're called locum tenens. They're like substitute doctors, if you will. So when we have a shortage, we have to have psychiatrists on because they have to be on call all the time. So if for a while we had a shortage of psychiatrists, we didn't have.
So that's
them.
why
when they go on vacation, we have to bring in locum tenens to cover their shifts and things like that. So that's a fairly expensive. And I just wanted to say, because this did come up in another town, and I have annual reports for you as well. As far as printing and things, I know this looks really nice. I have a lot of printer friends and a lot of graphic design friends who are very kind and generous to us, and so when you see something like this, just know that we certainly did not pay full price for something like that. It was basically donated.
What is your year end? Is it August?
No, it's July.
July.
June 30th, July to June.
July 1st.
So this August one is only 1 month budget?
Right. That's what we just passed out was for October, which is what we just closed.
I had one more. I'll get that. That's it till I look at the rest of the paper.
If you think of something, I'll be back.
Okay.
Jules?
Christine had asked about the increase, the 81%, and I know you said you couldn't pinpoint that, but I was wondering if you said that it happened across all populations, more or less. Can you tell me what that increase, the nature of those, was due to?
For each town?
Not for each town, but in general, there was an increase, you said.
Right. So we saw a slight increase in total patients served, but then in emergency services is where we saw the biggest increase. So,
Due
like
to...
I said, I can't really say,
Well, like the general...
My thought is what I had said to Christine is that, I think people are more aware of the services. I think people are...
But these are also people who are in crisis.
Right.
So for the most part, people are in crisis.
Right.
So they're suicidal, they're quickly into a deep state of depression, they have harm to others, thoughts or ideas of harm to others. So these are typically crisis incidences where we're trying to get someone out of crisis. So it's pretty significant.
Understood. So do you do any sort of studies to kind of follow these demographic sort of trends as far as detailed, like what types of crisis? I'm just curious so that you can sort of project into the future possibly, or just kind of get a handle on, 81% is huge.
We do track all of the I could probably get that data for you. We do track all of the emergency services contacts so that the emergency services team tracks, how many face-to-face contacts they had. That would be like if somebody went to the hospital, if the clinician went to the hospital and saw somebody, they track the number of telephone contacts, the number of admissions to New Hampshire Hospital that they did. So they do track that. I'm not sure if they track, if they ask, what they ask what brought them there, but do you know what I mean? I don't know that we could get any more detail than that.
Just because it's such a significant number, it's, I think, worth researching.
I'm also the Vice President for Enrollment Management and Student Affairs at Plymouth State, and we've seen a 400% increase in our need for counseling services of our students. So we literally have added a full-time counselor an additional full-time counselor every year for the last 3 years. So just kind of societally, we're seeing this large change around, certainly the awareness and the stigma has definitely gone away, which is great, or lessening, but certainly there is something around the lack of resiliency around where people seem to be heading in our society right now that is also a challenge.
Thank you. Yes, thanks.
On top of that, is there any correlation with the drug usage? Do you get those kind of people in there? Because they're going to be obviously say they're suicidal, they're this, they're that, or sometimes just get more drugs or whatnot.
Well,
or help the real...
That the vast majority of people with addiction issues have a co-occurring mental health issue. Just think about it. If you are an addict, you are likely to be depressed, just in and of itself. So there's, certainly that was going through my head as conversations happening, that I would be surprised that some of the uptick we're seeing is not related to that uptick also in substance use, but that's my just listening to the conversation and knowing what's going on, I would imagine. So I think Kristen would need to ask folks to pull some numbers. I would say, as we all know, New Hampshire is a very small place, so I would think you probably wouldn't want to pull numbers just looking at trends in Tilton, but you'd want to look at trends across the board emergency services. Let's face it, you just put out 2 cases, probably half of you would know who they are. And the law would prohibit us from revealing that much information, right? So, in terms of trends, you probably are not, you might be able to look at Tilton trends over multiple years, which would probably be, your IT folks would probably kill me for even saying that. But, you probably really would be looking more at trends across the board emergency services. So you might not be able to really drill down that solidly into exactly what happened last year in your Tilton numbers, just because of our confidentiality.
Right.
Almost up.
Jane,
You have looked at that apparently, because you're giving us an 81% increase over 3 years, so somewhere somebody's looked at it. You said you go to other towns. What other towns do you approach for funding for emergency
We
services?
go to all of the towns that we serve, which is all of Belknap County and then southern Grafton County. So we serve 24 towns in all.
And how many of those contribute?
17.
17 contribute?
Correct.
It's actually in your packet, it has
Okay.
by town by town.
All right. You say that the money that's allocated from the Belknap County Commission goes to adult outpatient programs?
Correct.
If I'm an adult in their outpatient program and I am in crisis, where do those funds come from? From the emergency funds?
Well, you would still be able to utilize emergency services like anyone else, but what the adult outpatient.
So,
But
but
the-
that money would that money come from the emergency services fund, or would that money come from the Belknap County contribution?
It comes back to the piece of what the service is for, because it's a
Okay.
code, it's a billing code. So if you are in crisis
Okay.
and you go through that 911 usually process,
Yeah.
you're going to get coded as emergency services, regardless of whether you are an existing patient through the outpatient or new to us.
Okay.
So it's really that code.
All right, you say that 47 emergency services, how many patients does that equate to?
47. We saw
So-
47 people in emergency services
that-
from the town of Tilton last
Okay,
year.
and that's the number, so 47 people were served out of the funds?
Correct.
Okay.
Well, 47 people were served in emergency services from Tilton. The way
That's
the way
what
we
I'm at-
right. So the way
yeah.
we structure our request is again based on a suggestion from you folks. We take a portion of the emergency services deficit, which is generally around $300,000 to $350,000 a year. So. So for this request, it was, I think, $175,000. So we wanted to reduce it by that much. We take the population of Tilton, which is 6% of our catchment area, and that's how we come up with the $10,500 request. So this year, for all of the towns that contributed to us last year, we did not ask for an increase. We asked for level funding because, as Jim said, we did have a good year and things were better when we were under the managed care per member per month system. So we did not ask for any increase last year.
Okay. You just received a very large grant.
Correct, we did.
What is that being used for, $6 million?
Oh, it was $1.6 million over 4 years. I'm going to actually let Susan explain it because she is, the organization she worked for had this grant before.
It's a primary behavioral health care integration grant from the Substance Abuse Mental Health Services Administration. Yes, it's a primary behavioral health care integration grant from the Substance Abuse Mental Health Services Administration under the U.S. Department of Health and Human Services. Individuals with severe mental illness die on average 25 years earlier than the general population. They have an average life expectancy of 53, which is the same as someone living in sub-Saharan Africa. And they don't die from issues necessarily relating to their mental illness. Most often, they're from comorbid health conditions, frequently complications of diabetes, heart disease, things that we know are very treatable and are certainly preventable deaths. The reality is people with severe mental illness do not access primary care very well. The two systems don't work together very well. For example, my primary care provider has a rule that if you are 10 minutes late, they no-show you. If you have 3 no-shows, they terminate you from the practice. Now, if you imagine you're someone with a serious mental illness, a thought disorder like schizophrenia, it may be difficult for you to remember your appointments, always show up for them, and so that it's difficult for you to access primary care. You may also not be comfortable in the primary care doctor's office. Frankly, a lot of primary care offices aren't comfortable having you there. So SAMHSA, the Substance Abuse Mental Health Services Administration, about 5 years ago started putting out these requests for proposals for these integration grants, to integrate primary behavioral health care, to put primary care into behavioral health centers like Genesis in order to try and stop this early death for people with serious mental illness. Genesis has tried, this is our second attempt? Second attempt. So we had tried a few years ago, did not receive the grant. I did work for a mental health center some years back that received one of the first ones 5 years ago, more than 5 years ago, I guess it was now I'm thinking about it, in Nashua. And we did see that indeed it helped reduce actually costly interventions like hospitalizations for these folks. We did also see, because it sounds like a lot of money, but when you start talking about you're going to provide primary care within your behavioral health center, quite frankly, it was a money loser. It was a good thing when you brought in the piece of, for the hospitals, it reduced their cost, but in terms of for the mental health center, it didn't actually generate income for us because it costs really more to provide those primary care services, which doesn't mean we shouldn't do it because people should have access to them. So yes, it sounds, and we're really thrilled. We're thrilled for our patients, but we're really anxious too because we know from the other places that have done it that this is going to be really tight for us to make this work.
And the majority of the funding is going to, retrofitting some of our office space to make that conducive to primary care. So like we have to create exam rooms, we have to buy all the supplies for that. We had to hire a grant administrator. It's a really big federal grant with a lot of reporting requirements. It's not something that, I can manage along with all my other work. So we had to hire somebody to do that. And the majority of the money is to hire a primary care provider who will be in our offices. So we'll be having, we'll have somebody in Plymouth and Laconia. So there'll be somebody in Plymouth 2 days a week and in Laconia 3 days a week.
Thank you. Anything else? Mine is really easy, just a couple of statements. One is, for the members of the board, I'm an old practicing social worker, and you think the expenses are high. When in 2007, when I retired, in order to get a psychiatrist to do on-call, it was $100 an hour for 24 hours on-call. If the psychiatrist was called in, he not only got his $100 an hour on-call, but he also got any time he spent in facility on top of the on-call pay. So in one day, a psychiatrist could make over $3,000. So they're not cheap. Second thing is, with primary care physicians, many are still very resistant to deal with any psychotropic meds at all because of liability issues, and they don't understand them. If you have a family practitioner, they have a real hard time prescribing anything outside their realm. There is a concern around town about creating maybe a position called a liaison, where a representative from Genesis meets and communicates with the different health and welfare directors around the areas. So everyone is on the same page. Everyone can voice their concerns. So that would be something I would suggest that you look at. And yes, John, you kicked me, and I will, if asked, join your team as a representative. John, how's that for leaving?
See, we got you one.
I like setting up the select.
No, actually, it's been very informational and stuff you've been telling me. And no, last year would be the first year that it's mandatory for everybody to have insurance, and there was a lot of outreach by even like the hospitals, Laconia, to get people signed on. A lot of people that had no insurance finally realized that, hey, I can get Medicaid or stuff like that for free. Did that have an effect? I mean, so that you guys could start billing for some of these things? And
Absolutely.
Does that show up in here? Because it seems like you're running negative, but there's been this influx of...
So it definitely showed up in our charity care last year. So we saw a fairly sizable reduction in our charity care last year. It was about $216,000, whereas the year before, I believe it was close to $800,000. So we definitely saw, and it's attributable certainly to the New Hampshire Health Protection Program and getting people enrolled in that. And as I said to Catherine earlier, we have benefits. We have 2 benefit specialists specialists on staff, and that's their job, is they, when somebody comes in who doesn't have insurance, they work with them to get them what they need to navigate that system and get them Medicaid. We also worked very closely with the hospital and with Service Link and with other marketplace assisters, so that if somebody, didn't want to do it through us, we could refer them to someone else. But we really did whatever we could, because it was truly a benefit to the organization.
Before you get, don't be shy, if you'd like us to take a look at those.
I can. I was going to.
Those just,
For you.
for everyone on.
All right.
We also
Loose.
found that many patients through the process needed to change providers as well, and so we also were very helpful in trying to assist them in getting what they felt was the right provider to
No, I go this
help
way.
them, support them.
Okay.
Thank you. Sorry to be bobbing around. Keep going, you're doing good. John, continue on.
Last year, I guess, I'm looking at, there was only like a 10% increase of actual emergency services, so that was 85 over 3 years.
Right.
So that was, when was
Yep.
the big jump?
81 of these. So in fiscal year 13, we saw 26 people in emergency services, and then last fiscal year, we saw 47. So that was the jump. In fiscal year 13, we saw 129 Tilton residents total in all of our programs, and then last year, we saw 147. So that wasn't quite as large of a jump, but it was a little.
Are those individual services, or are they just, they could be the same person a couple times, or?
Nope, that's unduplicated. So that's
Unduplicated.
individual. So that, so last year, for example.
So the 47 actually could have been double
Yeah,
or triple that.
that was included in the 147. But,
Okay, I see.
so we saw, of the 147 total residents we served, 45 of them were children, 92 of them were 18 to 61 years old, and 10 of them were over 62.
I can think of a moment then.
Would you like me to come back? Come back to you?
Oh, I'm also.
Oh, yeah. You got it. All right, John. You really got it, John.
I thought so, that's all.
I'm going back at old notes that I wrote when I first got this, but the 47 people in the town of Tilton that you provided emergency services for, how many of them did not have insurance?
I don't know that off the top of my head. I could try to find that out for you.
And then I have a question of private insurance versus public, and I don't know why I wrote that, and I think it's kind of related to that.
Were you just wondering maybe the difference between it? So public would be Medicaid and Medicare.
Right.
Private insurance would be like Blue Cross Blue Shield, Harvard Pilgrim, those types of
Yeah,
insurance.
it's just a note I wrote, and it was a month ago, and I don't.
Private care plan might be, they might cover the first X.
Right.
Maybe that person didn't have the ability to pay, which could have gone under charity care, and then on their third visit, they had coverage, or it was a dollar amount. And eventually went to charity care before they couldn't pay for the services.
What, and I don't know, this might be another question you can't answer, so what is the average cost of an emergency service?
I can find that out for you as well. I do know that, I just don't have it right at my
Are
fingertips.
we talking thousands of dollars, hundreds of dollars?
Thousands of dollars.
Okay.
Probably tens of thousands of dollars, depending on how long that person was in the ER. So just as an example of what could happen, I think we all know there's a shortage of beds at New Hampshire Hospital. We do have the DRF in Franklin now, which has helped, but there's still a bed shortage. So getting somebody, if somebody does require admission, which, the goal is to get them back into the community, but if somebody does require admission to the hospital, it's quite a lengthy process. So they have to be medically cleared by the hospital. That can take hours. Sometimes our clinicians have to keep going back. If somebody's there for more than 24 hours, which has been unfortunately the case more often than not, I mean, people have been in the emergency room for days waiting for beds to open up at the hospital. Our clinician will have to keep going back every day to reevaluate that person and and go through that process again.
It's checking
Right.
patients, how it's going, is it working out, what's the reaction to that? Yeah.
So it's likely tens of thousands of dollars. I can tell you what the cost, or what the reimbursement rate is for emergency services does not come near to what the actual cost of us providing the service is.
And then you said over the last 3 years, you've had an 81% increase. Is that, I was probably writing notes, was that just an emergency, or is that overall people seeing in the town of Tilton?
That's just in emergency services for the town of Tilton. Overall, over the last 3 years, it was 14%.
But you're only anticipating a 10% increase next year?
Right. I went from year to
I
year.
know it's probably just throwing a dart.
So over 3 years, it was 81%, but when I looked at what we did last year, what we did in fiscal year 14 to 15, it was closer to 10%, so it was trying to keep
So
it
a
more
couple years
level.
ago, there was a big jump, and then
Right,
it's kind of leveled
exactly.
off. Okay.
Still increasing, but not at that high.
Yeah, it's not going
higher
like
rate,
this.
yeah.
It's kind of, okay. I'm good for now.
Peter,
I'm good, thank you.
you're doing well reading, doing well.
Well, Eric asked a couple of my questions, that I was going to ask how many of the 47 you self-pay. I think that's important, because we both have that question to get back with us on that answer. I'd really like to know that. You mentioned that there was a big decrease in your charitable from 800,000 down to 200,000. So where did you utilize the rest of that funding this year? I mean,
Well, we don't get funding so that's money that we lost every year. So this past year, we just didn't lose as much. So
part of that comes from the insurance. So since more of those people were under insurance, we received the additional revenues from that now that the state has, again, cut our funding. So we were at a different funding rate for this last year. Now we're into a new funding rate for this year that is 30% less than it was the year before. So we are potentially heading back towards more deficits in that way, because
let's say an elderly person is in crisis and she goes to the ER and you folks come in, meet with them and see that there's a need, and they follow up with you. What is the percentage of client social worker clients ratio?
I don't know what specific, are you looking for like therapists or case management?
Well,
we do have two individuals who their specialty is working with elders, and they have actually done a lot of outreach in Tilton, and I believe worked with the senior center to provide some programming and training and education, and that's through something called the REAP program. So, we do have those individuals, but I'm not sure of the percentage. I could probably find that out for you as well.
One of the difficulties that I have in dealing with seniors over the last 5 or 6 years that I've had the senior center and doing outreach with seniors, we on occasion have to bring them up with Genesis and Macomb. More often than not, they come out and they're so agitated and frustrated because every time they go into the building, they see a different person and not the same person that they were dealing with. So, to me, having a mental health background, I would think that that would be disturbing to anyone that had any kind of mental health issues. That's why I'm asking that question, is that I understand there's even a smaller ratio, a larger ratio for psychiatrists towards social workers, but I'm trying to get a gauge, because is that been corrected over the years, or Is it still an issue with you folks in that area?
We did have quite a bit of turnover, in significant part because of our pay. And so, again, as we had retooled, redesigned our entire system this last year, we are really a different organization than we were 2 years ago. We were, with this managed care concept, we were able to increase pay, and some of it we were significantly out of market as you would compare them just within the state. So we have lessened our turnover. Again, we are worried about going back into this new state where we won't be able to give raises again and compensate people adequately. So it is part of our history, without question, is that we had some significant turnover.
But is it part of your future?
We actually recently completed our strategic plan, and this was obviously an issue that we were looking at because we had a turnover issue. And you're absolutely right, it affects any patient receiving services, it doesn't matter their age. And what we did is because ultimately, we are striving to create a workplace that will encourage people to stay and increase our retention of the staff. But ultimately, as you know, you can't force people to stay working for you. What we are moving towards now is a real team-based approach, so that there will be, any person would have contact with more than one person, so that if one person from the team who's providing care should move on, there's still people that you will know and have relationships with, so that we can provide. So this is one of the sort of safety mechanisms we're trying to put in place to help alleviate some of that, so that you won't just have one person and then, Jane left and now I don't know you, but it will have been, I've had treatment from a team of folks and that will be overseeing your care, and so that you'll still have some continuity. And we've had real success with that.
So you're creating a team, a small team that will work with these individuals, and that they will only be working with that team.
Right, so that,
They won't be out and around all of the individuals.
So
that's the concept.
So that you would have, so that if one person left, you'd still have a relationship with other people on the team. And it is an evidence-based practice that's been employed for specific populations, particularly people with the most severe mental illnesses in the past, through what's called an assertive community treatment team, which is shown to be very effective, and that's sort of where and it has been for us. We started ACT, 2-3 years ago?
So you just implemented that 2 or 3 years ago?
I think 2 years ago, 2.5 years ago now, the state gave us funding for ACT, that was just for that specific people who have the most difficult, most apt to be hospitalized, have self-injury, those kinds of things, most resistant to receiving services, because some people with mental illness don't think they have a mental illness. And that's proven, quite frankly, my family member, it probably saved his life, the ACT intervention. But he has relationship with all the members of the ACT team, and there has been some turnover since he's been being treated by that ACT team, but he's always still has someone there that he knew, so that he still maintained it. And he has, I'm telling you, 2 years ago, or 2.5 years ago, I wouldn't have thought he'd be alive today. And not only is he alive, but his quality of life has improved, and he's working part-time. So it's just been a dramatic change. Now, obviously, that's just one story, but we're trying to do this team approach and implement it across the agency over
When did you start to do that?
We only just completed the strategic plan, and so we've come in
So it hasn't been
September.
implemented
So
yet.
we're in the process of implementing.
We're in the process now.
But it is to address that very concern that you're raising, because we can't chain people to our agency to work there forever.
Although, I will say, we do have, workforce shortage in mental health is across the board. That's not just a Genesis problem, that's everywhere, because the pay is very low, and it's hard work, and it's incredibly
Terrible.
stressful. And a lot of the people that we get coming to work for us, they're right out of college, they're going to move on. It's inevitable, and we don't like it either. But I would say, to Susan's point about chaining people, for all of the stories about people that, leave quickly, which is unfortunate for the patients, it's not good care, and we know it. But we also have people who have worked for Genesis for 35 years, a lot of them. We probably have a number, right, and they did it because they wanted to. And, so there are a lot of people, I would say we probably have 10 staff who have been with us for 20 years or more, which is pretty significant. So, you know, we're aware of the problem and
No, your concerns are valid.
correcting
I
it,
mean,
absolutely.
family member.
I just don't know how you could correct that. And, you know, I'm not sure that funding from the town of Tilton would correct that, I guess is what I'm saying. That's an internal problem which needs to be addressed that I think could have been addressed a long time ago, that on different levels. Trying to think of a word in a way that I could say it and not be negative, because I don't want to be negative about the program, because that's not what it's about. I've seen some very good results coming out of the programs. However, when you're asking the town, and when you ask the town, you're asking us to ask everybody that lives here to go in their pockets and take it out for people that you're helping. We want to make sure that I drive the senior up there, that they're going to help when the police department drives someone to the ER, that they're going to have follow through. And when there's not enough therapists and social workers that are going to deal with the people that you have on a consistent basis, then it doesn't, to me personally, it doesn't really have a good outcome, because the frustration level, it's just circling.
I think we certainly
circling the
hear
drain.
that and we understand that, but the contributions that each town gives helps us to be able to provide for our staff and to ensure we're creating a better environment to retain and keep our staff forward. So each town's contributions do make a difference in how we're able to.
But you've known this for a while, because I think this is might have been third, fourth, fifth year maybe that I've brought this up. And
really were in that negative deficit for so long. That is why this has become really a challenge for us, and that's why we had this really strong year. We've been able to implement many of these changes, do the restructuring that we needed to do, and that's why we're coming back to the towns asking for additional support.
so let me ask this question then. How would our $10,000 secure our seniors and young adults, or anybody, doesn't matter, warranty them a certain follow-through when they're in crisis?
I know, it's not on there.
To me, that, we're not dealing with our library that needs extra staff and extra books. We're dealing with you. And, you know, I know you know that. And it's very, very difficult to say, here's $10,000, but I want to really, how can you ensure to me that that $10,000 is going to be spent and ensure that when you have a patient, 47 patients, that's why I asked self-pay, because some of them I know that have gone up there are self-pay. But go up there that are not self-pay, that actually have that follow-through, that are consistent, and that are not put out back into society to be put back into an ER situation again and again and again. I know a couple of them.
And I think part of that, Pat, is the structural, when Tilton's representative meets with the rest of the representatives from the community, this is where that comes forward. Why aren't we doing this? And I think it's more of the, how do we attack the structure? And that needs to come from within. And it's been years since we've had a representative sitting there saying, no, we need to change this, to look at that. And that was one of the ideas that I was looking at with the liaison, having someone from Genesis that does nothing but liaison work with the towns. What are the problems? How do we correct the problems? How do we get from point A to point B? How do we make sure that our money is being spent effectively on the clients. And agreed, mental health has not done well in the last 5 years. Hopefully it's turning a new leaf.
Anywhere.
It's anywhere. Hopefully it's turning a new leaf. Part of that is those structural changes that are now coming around. So I will be back to you in a minute if you'd like. If not, I have other folks that want to do some concluding questions.
I have additional.
Go ahead.
Do you guys have any volunteer, whether they're, low or high-end people there?
Volunteers, all of our board is volunteer. We also have committees of the board, so as Jim mentioned, the finance committee, we also have a development committee, a governance committee.
How about workers?
Advocacy. We don't have volunteer workers. We can't do that because of HIPAA and because of the way that since we're a healthcare provider, so we have to bill insurances, and we can't do that unless people are credentialed.
Well, you have volunteers working for you, though, in the development office, so, I mean,
Yes.
utilize them when you can.
Yes, I mean, we use them when we can, right, we can't use them to provide clinical services, but I have volunteers, I have high school students who help me with mailings, I have, people who
Yeah,
come in and
I have a
things like
family
that.
member who's a psychiatrist, and I know he hated to, let's say, retire, because you almost get forced at a certain age sometimes. And he did volunteer work in his field, and that was still acceptable with HIPAA regulations. He's in Ohio, obviously, not here, but it's the same regulations, so I don't see why you can't, look at that avenue.
Right, and I think that's one to look at. The important part is the credentialing, and a lot of folks...
In that field, yeah.
Yeah, in if they're credentialed. The issue with retirement is it's a hard thing to keep your credential up because of educational credits, and so it becomes a real bind for folks.
It's actually a cost for the organization to have you credentialed, so, in New Hampshire. So, which is not to say, and there's also the piece of, you would probably still have to pay somebody, even if they wanted to, a minimum amount, just from an insurance perspective, in order for them to be covered by your insurance carrier, so in New Hampshire. But that would, I'm sitting thinking, well, pay them $1, and probably they would be, but...
But again, it's something and Christine, I think you're right, it's something they can look at.
Yeah.
And we have had retired psychiatrists who have just wanted very part-time work, who have come in and worked, maybe one day a week or a couple days a month, just to, we have had that situation. It hasn't lasted for very long, but we did have...
The reality is, there's a critical shortage, not just in New Hampshire, but with psychiatrists. Literally, medical schools don't have enough slots to train enough psychiatrists for what's needed, so it's a national thing, but we have was it your uncle? Because if he would like to move to New Hampshire. Boy.
I'll call him up.
You volunteered yourself for the board and your uncle to do volunteer work.
Doctorate levels are very tough. Jane, you had a question?
Yeah, I got 3 questions.
Okay.
The veterans home, and veterans, they're an issue. And I think it's even in here about the number that commit suicide and so on. If someone's in the Veterans Hospital here and they are in a crisis situation, are they eligible for your services?
If they're in Tilton, absolutely.
Okay.
Yeah, I don't know, anybody in, emergency services is available to any resident of any town. As I said, no matter, that's why we ask.
But I mean, they would use your services if they needed them.
And if they chose to, because they should be able to access services through the VA Medical Center, which of course we know is in Manchester.
Right.
I will say, the VA system will not reimburse the mental health center. So what we do definitely have individuals who, particularly because of the stigma, especially for people who've served, around mental health issues, that they don't want to go to the VA for mental health treatment, so they may want to go to the community mental health center, and then there is no reimbursement mechanism because technically they are insured, although that insurance mechanism won't reimburse community mental health.
Yeah, the other issue with that is...
Part of the charity care.
They do have in-house medical right there at the VA.
There are some people who don't want the VA to know they have a mental health problem.
Now, the Soldier's Home is a state institution, so therefore it follows the state. If there's an issue, the state has to provide the service, not the county level. So that's one of those state, which is then reimbursed by either Champus or by the VA.
Okay, I was just curious.
Yeah.
Then, my next question is, with the rise in the drug crisis in New Hampshire, have you changed your organization in any way to be available to help in that drug crisis?
Yeah, so what we have partnered with other organizations in the community to, collaborate on that and to, make sure our resources are available. As Susan said earlier, most people will likely have a mental illness as well or a mental health issue. So we work pretty closely with Horizons and with the police department and are on several collaborative efforts around that.
Actually, we're part of a community collaborative, and I'm not sure what we're calling that.
Yeah, with the 1115 waiver.
1115 waiver.
I don't know what the name of it is.
And we have been, it includes the hospitals, it includes the substance abuse providers, it includes primary care providers, public health, and looking at a host of behavioral health issues, but especially the current opioid crisis has been a particular issue, and we are partnering with both the hospital and Horizons in terms of trying to make sure people get where they need to be and particularly access those replacement therapies that we find are so critical to saving lives.
Could I just jump in for 1 second? If a client comes in with a primary diagnosis of a substance abuse problem, does he or she also have to have either an Access 1 or an Access 2 diagnosis in order to get your services?
They have to have a primary diagnosis of a mental health issue, correct? Is that how that is?
So the drug abuse has to be secondary?
I believe the drug abuse is secondary, but don't quote me on don't quote me on that. You have to have both.
Yeah,
but I think
it's really, and it becomes because actually a primary diagnosis can shift and so it.
Rare to.
We have a lot of folks that we serve that, some people would say their primary diagnosis is substance abuse. They are definitely our clients, and
Right, but they do have to either have Access 1 or Access 2, piggybacked with the substance abuse.
Yes.
Okay, go ahead, ma'am.
Okay, on this chart, what is uncompensated care?
That's charity care.
No insurance?
No insurance. It means it's the cost of care where we can't get where we won't be able to recoup it from any other source. So whether that's insurance or self-pay, it's just we provided the care, we didn't get paid back for it. So we provided the care for free. So when I say charity care and uncompensated care, they're interchangeable. So it's the same thing.
So we have some patients who will say, sure, I can pay, I will pay, and I need to see someone, then we bill them, we bill them, and then in the team concept that Susan was talking about is we're moving to that, we're now also trying to be more proactive to say, Kristen's not going to pay.
Well, I guess my question in asking that, this is 2015.
Yeah.
And it shows Tilton, you have uncompensated care of $5,448.
Correct.
I assume that runs the gamut of every service you offer?
Yes, that's all services.
Then why are you asking us for $10,000+ for emergency services only?
Because we use a formula to calculate the request for each town so that it's fair across the board. So we take what we want to reduce our emergency services deficit by, which was $175,000. It was over $300,000, the total deficit. We multiply that by the population of your town, since emergency services is available to every resident at any time. So for Tilton, that's 6%. So that's how we come up with the $10,500. And as I said earlier, we don't ask just for the amount of charity care because it fluctuates from year to year. So for Tilton, for example, in fiscal year 12, we provided $8,231. In fiscal year 13, we provided $21,500. In fiscal year 14, it was $20,411, and last year it was $5,448. So you can see for your town there was quite a reduction, but if we'd asked for just the amount of charity care each year, we would have been asking you for over $20,000, and that's not fair. So we do it we calculate the formula that way so that it's fair across the board for every town.
There's a question, Jane. We actually been looking at your website at the same time.
Oh, wow.
So we see me looking over here and I'm going, it really looks good. Thank you, it looks really nice. John?
No, I just, just such a complex thing.
It is a very complex system, and it's really hard to explain and understand unless, so please ask us questions. We
Yeah,
want to...
you know, I was looking at some things like the drug abuse thing, the grant that was given to Laconia to help out in their school system. What type of services are available for our school system? That was a $2.2 million grant. I think you worked on that, right?
We do, for Laconia, no, I wasn't involved in that. We do have staff working with that Laconia grant, with the Safe Schools grant. We do have staff for that. But things that are available to your school system, we have in the past had clinicians in Winnisquam schools. I don't believe we had this past year because of staffing shortages and issues. But we have had that in the past. We've had clinicians on site to see students right at the school so that their parents don't have to try to figure out transportation. And that's always a resource. So, I mean, we're available to school districts as we have staff available, and we're certainly available for consultation and things like that.
Well, I guess what I was looking at is, Laconia School District got a $2.2 million grant for substance abuse and mental health services.
Yep.
And they worked with Genesis on that. And
That was the Safe Schools Healthy Students grant. So that, what that did was Laconia, Rochester, and Concord, those three schools in New Hampshire received that grant. And that, again, allowed clinicians, that grant pays Genesis to have a clinician in the school. So that's why we're able to do that. So we have somebody on site. Yeah, we're the subcontractor, exactly.
For the school, so under our license, our insurance, our supervision, the school wouldn't be able to provide that.
The state was the applicant for
Yep, the state, I
Yes,
believe the
so-
state was the applicant for that, and they chose those three school districts
Right.
based on
I don't
need.
think we really had any
No,
input
we
on,
didn't.
we want to do that. They came and said,
Right.
oh, we picked Laconia.
And if you want to talk about complicated, not to cut you off, Genesis is responsible for the middle school and high school. Riverbend is responsible for the school over in Paul Smith and Southwick.
Yeah.
Union
And
Sanborn.
do you have Samberton?
No, I live in Somersworth, actually.
No, Samberton. Do you cover the Samberton?
Oh, do we cover Samberton? Yes, we do.
So they cover Samberton. So it's split. So if you want a counselor who is over, you have a child in Southwick that's going to the middle school, they have to go from Riverbend to Genesis. Don't ask me. Any further questions?
One's
John?
Merrimack County and one's
Right.
Belknap,
Yeah, Pat?
which is dumb, but
You said you got a $1.6 million grant. Where is that listed in the revenues?
It wouldn't be in those revenues because we just received it in October. So we haven't drawn down any money from that grant yet. We just received it as of October 1st. We've just been hiring staff. We haven't drawn down. So that wouldn't be in the audit yet. It wouldn't be in any of those financials yet because we haven't utilized any of those funds yet.
Good. Further questions?
Yeah.
Jarek?
And I'm running numbers, looking numbers here. Does Plymouth State contribute to any of the same fund that we're looking at here?
The town of Plymouth contributes from the emergency care perspective. We pay the town of Plymouth in a life safety service agreement as a part of their contribution. And we also have a partnership with Genesis, and they provide about 40% of our overall staffing for our counseling services.
Is that the university, or is that?
University pays for that.
Okay. It's good. I'm just looking at numbers here, and they're 38,000. They're your second highest uncompensated care, and I was curious at what percent or how much of that could be contributed to the college. Because, based on population, if you're doing your formulas based on population, they pay $7,500, yet they have $224 of patients served, so, it's double.
Right. And just to be clear, so you do have this chart in your packet of what the towns contributed.
Right, that's what I'm looking at.
This shows the allocation. What they actually ended up contributing may not have been what we requested. We likely requested more from all of those towns and maybe got a portion of it. Some of the towns give us the full request, some give us some of it, some give us nothing. So, it kind of fluctuates. If you wanted to see the actual request amount to each town, I'd be glad to get that to you just so you can see. But like when you're seeing that Plymouth, the town of Plymouth did 7,500. Yeah.
We had at least asked for at least 15,000.
Exactly. I believe I asked for 15,750. But I can find, if you're interested, I can get that for you easily.
Eric, further questions?
Nope, I'm just,
Concluding remarks from Genesis?
I just want to be clear of what information you all
Yes.
would like me to give.
And the other very point is, if you send that to Joanna,
Yep.
she will make sure it gets to us.
So I'm going to send you what our actual request was this past year for each town. I'm going to find out the ratio of clinicians to patients, the number of people with emergency services who were self-pay into the town of Tilton. We're going to sign Wayne up for the board.
I didn't mean to put you on the spot.
It's all right.
And the cost of providing emergency services.
Don't take them away from us.
You want to,
Oh, that's right, and her uncle's going to volunteer, so. I'm just going to ask for a little bit of patience in getting this information, because I know some of the people that need to get it for me are at a conference the rest of the week, and I'm actually out of the office the
We are
next 2
not
days.
in a
so
rush.
I will get it to you, I promise, but give
Thank
me
you
a
very
few
much.
days.
We're sorry we asked so many
Any other
questions.
remarks? If not, we've kept you long enough.
But it's progress, because we used to not even see you, right?
I know, so thank
And we're not,
you very
we
much
aren't
for
yelling at
having
each other for
us.
once.
And I hope that next year we can add you to our list of the
Yes, thank you very much
in town.
for coming.
Thank you very much.
Have a great evening.
Sorry we
Very
kept you
good.
so long.
Very good turning with it. We threw a couple curveballs at you. Looking at that was kind of nice.
Thank you. Happy to answer them.
Thank you very much.
Ma'am,
Thank you very much.
but enjoy the evening. Okay, it is 8:35, folks, and I would recommend strongly that we postpone the rest of the meeting order till next week. Next week, we have who, Joanna?
Sorry.
Next week, we have Child and Family Services and the Amateur Association for the Blind and Island Conservation.
I would also ask the board members to think of the following things. We need to come up with dates for our public meeting or meetings, whether we're going to have one or whether we're going to have two. One for the operational budget, one for the warrants, or together. And we need to have a date in mind that has to be before, what day, Joanna?
February 12th.
There was one other thing, the Old Home Day, we asked them for a copy of the financial statement and their budget request. However, they just keep giving us the exact same thing of what they spent last year and not what they intend to spend next year.
Okay.
Did I give you guys,
I think she sent,
submitted, I think it was their bank reconciliation, their checking
Yeah.
account? I gave you that.
yeah, but that has, you know what I'm saying?
Not what we
They-
want.
Yeah, they didn't say, hey, this is what we need the money for next year. And we've asked, I think the selectmen have asked, and...
We've actually
the
asked
budget.
them to come here, and they haven't.
Yeah.
Okay,
that's
So-
right, yeah.
Yeah.
let's deal with that next
We're
week.
running out of time, so I figured maybe if we could send them a note.
Send them a note. Also, I'd like the committee to think about starting to firm up some of our outside agency monies. And I believe, John, the selectmen's budget will be ready for the 18th?
It's doing real good. Yeah, we went through it last week, and we've got some
PowerPoint.
numbers down, and I think Tim will be submitting it.
Me too.
Good. Gene, the most important motion of the evening.
Adjourn.
John?
Second.
All those in favor say aye.
Aye.
Go home and enjoy your families.
We didn't go over the minutes?
Oh, the important thing is, I have signed the request for your stipends.
Yes, I was going to ask about that.
Okay, we just signed them tonight. Hopefully, but no promises, they will be here for next week. So the incentive is to come next week to pick up your stipend, which will be $300 minus taxes. Pat and John, would you do the camera? One or the other, okay?
When do we have to decide on who's getting what?
You all get the same amount.